recording. We're live, are we?
Yep.
Okay.
So I'd like to introduce you to Dr. John Hache, Pacific Health Options. And I'm actually sitting in Canada talking to him on beautiful Vancouver Island, having just done some fabulous training with him, and I'm blown away by everything that the Avazzia can do. And so, Dr. John Hache, tell me how you got into microcurrent and why you think it's the medicine for the future.
Well, I've been in practice for over 35 years, and I've been in microcurrent for 18. So previous to these 18 years, I was forever looking for ways non-invasively to deal with people's pain, chronic, acute, exacerbated, any kind of pain. They would come and see me in pain, and they would leave in pain because all I had was lotions, potions, and maybe some homeopathic remedies, some herbals, and it wasn't really, for me, satisfactory. So when I ran into microcurrent, I was able to see, to witness, and to do the things that really kept me awake at night. I could do 80% of just about anything, but it was the 20% I was not able to do that kept me awake at night, really.
I can understand that. I have the same kind of feeling. Why didn't that patient get better?
That's right.
So the new, I call them a family of the Avazzia devices, have they completely kind of filled in those spaces for you, filled in the gaps?
I think it was transition. At the beginning, we were limited in the amount of programs that were available to us. And as we learned more and more about microcurrent, because we were running ahead of the pack, if you will, and as we moved forward, we were able to get more involved in acupuncture, meridians, in the Eastern medicine, Ayurvedic medicine, chakras. We were able to understand the importance of inflammation in the body and the frequencies to best use. We were able to better understand the frequencies that actually regenerated different tissues and so on and so forth. So I think that now, over the years, we're starting. I'm sure that there are things that we're going to learn in the future, but I think right now we're about as far technologically as anybody has ever been in being able to help people, especially with chronic pain and beyond.
What's your vision for the future?
The vision for the future is that it becomes mainstream. It's not going to be a device that, let's see if this helps. It's going to be accepted. It's going to be the first thing that we're going to do. And only if this doesn't help will we look at heavy medications, opiates, or whatever. But right now, this is definitely the first choice that I can see in the future. And I'm seeing it already. I'm seeing it in accelerated wound healing. We're seeing it in like you saw one fellow who was terribly mangled with this terrible accident, and the only thing that medicine offered was to cut off his leg, and within a couple of hours of us working with him, as you saw, Anthony was able to get hope in his life back. Where the day before he came to us, he was contemplating suicide as the only way out. And we're seeing that. Why would we not be upfront with this technology when we're able to help these terrible cases that nobody else has been able to help? The same with this young girl that came to see us as well, who even neurologically was damaged, and within an hour and a half she was saying words and sentences that up to then she was only grunting, and she's 8 years old. You know, the things that we're able to do are a doctor's dream.
I think people don't really realize that when you're in pain, it completely alters your psyche. When you're in a lot of pain, people don't realize that it changes how you feel about life. You get depressed, other people say, well, of course you're depressed, or but actually pain changes your biochemistry, and so if you can get somebody out of pain, it is magical. It's amazing.
Yeah, pain robs you of who you are,
Exactly.
who you can become, because it becomes the only thing. All you think about all day long becomes that pain and the limits that it puts on your life. And if we can give you your life back, then that hope comes back. You see it in their eyes, and you see the limitless possibilities that opens up to them because pain had robbed them of that.
Absolutely. Thank you very much for taking the time. I'm really excited to be working with you. Thank you very much indeed.
Thank you, Marian. Looking forward to it.
Thank you.